Thank you for joining me. My name is Julian, and this is Medicare 101. If you are 64 years old or 65 years old, it is that time usually that we have to discuss about Medicare and kind of figure out what we're going to do and how you're going to position your Medicare benefits. So thank you for joining me this afternoon. Again, my name is Julian Heggie. I'm an independent insurance agent. My North Carolina insurance national producer number is 16554002. I've been licensed since 2012. I'm also AHIP certified, America's Health Insurance Plans. It's an annual certification. I'm currently certified for 2021, and I am currently licensed in 11 states. I founded Medicare Values in 2017. I focus on Medicare health insurance primarily. I love serving and helping pre-retirees and retirees understand their Medicare options and choices to get the most value out of their Medicare coverage. It's what I enjoy. I am a family man. I have two daughters, ages 12 and 4, going on 21 and 22. Beautiful wife. So I definitely love my family. I'm also a sports enthusiast. I'm a Boston Celtics fan, diehard, and a Dallas Cowboys fan, diehard. Please don't hate me for that. So that's a little bit about me. So what are you going to learn today? The top questions that I normally get in my work helping with Medicare benefits and coverages are, who is eligible for Medicare? When can I enroll into Medicare? Obviously, what are my options in terms of coverage? What are my next steps? Everyone wants to know how they can save money. That's very important, as well as where can I find information. What is Medicare? Medicare is a federal health insurance program for people that are 65 years or older. It is also a program for younger people that have certain disabilities and people that have end-stage renal disease, which is a kidney disease. So Medicare is a health insurance plan, health insurance program. And those are the three groups of people that it is for. Most commonly, Medicare is known for people that are 65 years old or older. And, those are the folks that, by and large, are having to make their Medicare choices and their decisions. Medicare was actually um, voted on in 1965. It was signed into law by President Lyndon Johnson. It took effect July 1st of 1966, and it has been going strong ever since. I believe there's well over 45 million Americans or more that are currently enrolled into Medicare. So it is, needless to say, a very popular plan and coverage here in the United States. So when can I enroll into Medicare? Basically, Medicare has a 7-month initial enrollment period, IEP, 3 months before your birthday month that you turn 65, the birthday month that you turn 65, and then also 3 months after your birthday month that you turn 65. That is the initial enrollment period. That 7-month window, you can enroll into Medicare. Enrollment in Part A is automatic if you already are receiving Social Security benefits, then you will automatically be enrolled into Part A and actually into Part B as well. Some people must sign up for Medicare if they are not receiving Social Security benefits, whether they have to, pay for Medicare Part A and Part B or not. Some folks have to sign into it. So automatically being signed into Medicare is not for those that are not receiving Social Security benefits. You will receive an initial enrollment period package which includes your Medicare card and other information about 3 months before your birthday month, or if you have disability and you're under the age of 65, you'll receive that initial enrollment packet 3 months before your 25th month of your disability in terms of getting enrolled into Medicare. So this period is very important because this is your opportunity to get coverage and to avoid any penalties. In most cases, if you don't sign up for Part A and Part B when you're first eligible, you may have to pay a late enrollment penalty, and we obviously want to, avoid those penalties if we can. We want to avoid those penalties. Okay. Medicare is administered by Centers for Medicare and Medicaid Services, CMS. That's who administers the health program. However, the Social Security Administration, they are responsible for enrolling individuals into Medicare. So you would basically contact Social Security to get enrolled into Medicare. Okay. You don't have to be retired in order to get Medicare benefits. Some people are still working and may have Part A. In some cases, some folks that are still working may have Part A and Part B, depends on their situation, but you do not have to be retired in order to enroll into Medicare. So what happens if you missed your initial enrollment period? So then you would fall into, or you would have to wait for the general enrollment period, okay, GEP. If you didn't sign up for Part A and or Part B during your initial enrollment period, you don't qualify for a special enrollment period, you can sign up between January the 1st and March 31st of each year. Your coverage won't start, however, until July 1st of that year. And you may have to pay a higher Part A and or Part B premium for late enrollment, for missing your initial enrollment period, that 7-month window that we were just talking about. Okay. Usually, generally, Part A has no penalties. If you enroll when you're supposed to during your initial enrollment period, um, and you don't have to pay for it. You qualify for premium free Part A. Typically, there's no penalties for Part A. If you miss your initial enrollment period, Part B premiums will be higher than what they would have been if you enrolled during your initial enrollment period. Okay. So Part B, the premiums will be a little bit higher because you will have a late enrollment penalty for enrolling after your initial enrollment period. Medicare Part C and Part D, if you missed your initial enrollment period, you will have to wait until the annual enrollment period, which is also known as AEP. That is during October 15th through December 7th of every single year. You probably recognize AEP because you will see an unusually amount of commercials and advertisements on television, on the radio about Medicare, and now is the time to sign up or to change your plan or to reevaluate your coverage. And there are basically sounding the alarm that now is the time to make those changes or to get signed up into Medicare, whether it's Part C or Part D. Medicare Part D, which is for prescriptions. If you miss the initial enrollment period, their premiums also will be higher, just like with Part B. If you miss the initial enrollment period for Part D, you'll have to wait until the annual enrollment period to enroll, but your premium will be higher because there will be a late enrollment penalty. For Medicare Supplement, you can apply after your initial enrollment period for Medicare Supplement. You can apply later. Okay. However, if you wait until past your initial enrollment period for Medicare Supplement, what that means is that you will have to undergo health questions by the insurer in order to get approved for that plan. It will no longer be guaranteed for you to get accepted into that Medicare supplement plan. The initial enrollment period for Medicare supplement is a little bit different than it is for just general Medicare. The Medicare supplement enrollment initial enrollment period is a 6-month window, which starts on the first day of your birthday month that you turn 65. So the first 6 months after um, the first day of the month that you turn 65, you have basically a, you know, automatic acceptance into a Medicare supplement plan, irregardless of your health. You will get accepted into a Medicare supplement plan if you enroll within those first 6 months after or on starting on your birthday month that you turn 65. But if you don't enroll into a Medicare supplement plan until after that 6-month period, then it is possible that your premium for that Medicare supplement plan will be higher based on any existing health problems. And it is also possible that you could be denied coverage for a Medicare supplement plan also. So these are some of the risks that are present if you actually do miss your initial enrollment period. We always recommend getting enrolled into Part A and or Part B 3 months before your birthday month that you turn 65. That is best practice. That way, you know that you're on track, and you really eliminate the risk of missing your initial enrollment period and then being faced with the possibility of having to deal with late enrollment penalties as you get into your Medicare coverage. Okay. So what if you work past the age of 65? Hey, I'm still working, I'm still active, I don't plan to leave my employer at age 65. That is absolutely okay. Many beneficiaries and seniors are doing that nowadays, working past age 65. Some are still working into their early 70s. It's becoming very common these days. So that's okay. You may enroll in Medicare Parts A and Part B after you turn 65. We definitely recommend that you talk to your HR professional and benefit advisor with your at your place of employment. You want to keep your records of your health insurance coverage. Make sure that you are very aware as to when your group benefits through your employer end, so that you know when you would need to have your Medicare benefits, Part A and Part B, begin. Whenever you do decide to retire, whether it's age 66 or age 68 or age 70, you will be eligible for a special enrollment period. Okay, so you will be allowed 63 days after your employer sponsored group plan ends. And that will be a window for you to enroll without penalty into Medicare Part A if you didn't enroll in that, and or Part B. Okay, so it is okay if you continue to work past 65. It is okay if you intend not to enroll into Medicare because you are still employed and working at your job. That is still okay. Okay, definitely best sign up before your group plan ends. That way you can avoid any types of lapses in coverage when it comes to your healthcare and your benefits. So original Medicare, what is original Medicare? You may have heard the term original Medicare. Original Medicare basically is Medicare Part A and Medicare Part B. Those two parts of Medicare together are called original Medicare. Medicare Part A is hospital insurance, covers inpatient hospital care, skilled nursing services, inpatient mental health care, hospice care, some blood transfusions, some home health care. Medicare Part B is doctor coverage, outpatient visits, okay, outpatient care, physician services, ambulance, laboratory services. covers durable medical equipment and some preventative care as well. Okay, so Part A and Part B is basically like the foundation of your Medicare. It's not everything that Medicare has to offer. It is just the original foundation. So you want to have, when the time presents itself, when it is appropriate, you want to have both Medicare Part A and Part B, which is basically your foundation, which is original Medicare. So let's dive deeper into Medicare Part A. What does Part A cover? Okay, Medicare Part A is hospital insurance. It helps cover inpatient hospital care. If you have to go into the hospital physically and have a hospital stay, have a surgery or whatever in the hospital, and you have to stay overnight, you are an inpatient in that hospital. Part A covers that care. Inpatient care in a skilled nursing facility, hospice care, home health care, inpatient care in a religious non-medical healthcare institution. Okay, some important notes about Part A: cannot be denied coverage due to medical history or pre-existing conditions. For most people, there is no monthly premium for Part A. If you have worked for a minimum of 10 years, 40 quarters, in the US and you've paid FICA taxes for that time minimum, then you qualify for premium free Medicare Part A. All right. Most people meet that threshold and they do not have a premium for Part A. However, if you are someone that has worked less than 40 quarters and you've paid less than 40 quarters into Medicare over those time frames, then you can still sign up for Medicare Part A. You would just have a premium that you would have to pay in order to get that coverage. Okay, but most people have Medicare Part A at no premium. All right, Medicare Part A is responsible for your hospital coverage. You would be responsible only for a deductible for a hospital stay. The benefit period for Medicare Part A initial is 60 days. You go into the hospital, you pay that one-time deductible. That deductible is going to cover your coverage for 60 days. Beyond that 60-day period, then you run into daily deductibles, and it goes up the longer you stay in the hospital. But the first 60 days, you're covered once you pay that deductible. Okay. Multiple stays in the hospital, you have multiple deductibles. So you go into the hospital, you have a hospital stay for 40 days, you go home, a week later, you go back into the hospital for, another issue, you have a new deductible for that new hospital stay. So that's one of the things with Medicare Part A. Multiple stays will equal multiple deductibles. I believe the deductible for 2021 for Medicare Part A is $1,484. So that is the Medicare Part A deductible every time you go into the hospital for a 60-day grace period. All right. Every new 60 days, then you have a new deductible that you have to meet. You can be treated anywhere, any hospital that accepts new Medicare patients, okay, anywhere in the country. So you're not limited by networks or state lines. Okay, international hospitals typically don't cover Medicare Part A. So that's typical. So inpatient hospital stays, to get a little bit more in detail: semi-private room, meals, general nursing, hospital services, and supplies. Includes critical access hospitals and patient rehabilitation facilities, inpatient mental health care, and psychiatric hospital. Okay, skilled nursing facility, semi-private room, meals, skilled nursing and rehabilitation services, and other services and supplies. Home health care services can include part-time or intermittent skilled care and physical therapy, speech language pathology, continuing need for occupational therapy, some home health care, aid services, medical, social services, and medical supplies. Hospice care for terminally ill, um, and includes drugs, medical care, and other support services for Medicare approved hospice. And in some cases, in most cases, if you need blood as an inpatient in the hospital, you won't have to pay for that or replace it as well. Okay, Medicare Part A will cover that as well in most cases. So, what about Medicare Part B? Medicare Part B is the second half of original Medicare. Medicare Part B covers your medical, covers your outpatient services. It covers doctors, uh, primary care physicians. It also covers specialists, outpatient care, home health services. Durable medical equipment is covered under Medicare Part B. Your wheelchairs, diabetic supplies, okay, covered by Medicare Part B. Mental health services, other medical services, many preventative services are covered by Medicare Part B. You get have an annual um, wellness check, mammogram, pap smear, those types of preventative procedures are all covered by Medicare Part B. There are some important notes about Medicare Part B. Cannot be denied coverage due to medical history or pre-existing conditions. 20% coinsurance of Medicare approved cost. So there's a 20% coinsurance with Medicare Part B. Okay, if you are in the hospital, Part A is going to cover your hospital stay, but the services provided by the doctors in the hospital falls under Medicare Part B. That comes with a 20% coinsurance bill. There is no maximum out of pocket for Medicare Part B. So that 20% coinsurance has no limit. Okay, it could be $1,000, it could be $20,000, it could be $100,000. There is no cap on that 20% coinsurance under Medicare Part B. There is a monthly premium for Medicare Part B. It usually increases each year, but there is a monthly premium for Medicare Part B. And premiums, as I mentioned earlier, Medicare Part B premiums may rise if you enroll into Medicare Part B after your initial enrollment period. All right. So this is the second half of original Medicare. And if you notice there up on the screen, there is a picture of a Medicare health card. We call it your red, white, and blue card. This is your red, white, and blue card. And this is basically your insurance card when you are using original Medicare. So when you go to the doctor's office or if you go to the hospital, um, this is the card that you would present as your insurance card when you're going in for coverage so that they will know how to bill you. It has your hospital Part A start date printed on the card. It also is going to have your medical Part B printed on the card as well. It's going to have your Medicare number, your Medicare beneficiary identification number. Okay, it's going to be a combination of letters and numbers on your Medicare red, white, and blue card. Okay, and that's your Medicare ID number, basically. All right, so this is Medicare Part B, which is definitely a part of original Medicare. So as I mentioned, original Medicare Parts A and Part B, that's your foundation for Medicare, for your Medicare coverage. You want to get enrolled into Medicare Parts A and Part B based on, if you already receiving Social Security benefits, you're going to automatically be enrolled into Medicare Part A and Part B. If you're not receiving Social Security benefits and you're going to retire at age 65, you want to enroll into Medicare Part A and Part B through Social Security, okay, prior to your birthday month, preferably. All right. But Medicare Part A and Part B is not totally comprehensive. There are some holes or some gaps in coverage in terms of deductibles, co-payments, and co-insurance. Medicare Part A and Part B has some gaps in it. All right. And so typically, Medicare beneficiaries will have to get additional coverage in order to cover those gaps that are in original Medicare. When it comes to the additional coverage, beneficiaries have an option. You have an option as to which way or how you want to fill in those gaps or those holes that are a part of original Medicare Parts A and Part B. Typically, there's two choices. You can choose a Medicare Advantage plan with prescription drug coverage. That is Medicare Part C. Or you can choose to add a Medigap plan, also known as a Medicare supplement plan, and add with that a prescription drug plan, which is also known as Medicare Part D. All right. Those are the two choices that you have to fill in the gaps or the holes that exist in original Medicare. Medicare Advantage plan, Medicare Part C, which is Medicare Part C, or elect to sign up for a Medigap, Medicare supplement plan, and also a prescription drug plan, Medicare Part D. It's one option or the other. You cannot do both. You have to choose one or the other. And then there's also other optional coverage like dental vision plans that are also available for optional coverage as well. So Medicare Part C, which is also Medicare Advantage, and these are a lot of the commercials that you may see on television. What is Medicare Advantage? What is it? What is it about? All right, Medicare Advantage is Medicare Part C. Must be enrolled into Medicare Part A and Part B. Must have original Medicare in order to enroll into a Medicare Advantage plan. Plans are offered by service area and are frequently limited to the service area. So you are required to pick a plan that is only available for your area. So you may live in one part of town. You may have a close friend that lives in a close neighboring town, and both of you may have Medicare Part C, but based on where you live in your area, you may have two totally separate plans based upon what's available for your specific service area. Um, you cannot be ineligible because of health or financial status. If you want to enroll into a Medicare Advantage plan and you have an opportunity to enroll into a Medicare Advantage plan, irregardless of your health, irregardless of your financial situation or status, you can enroll into a Medicare Advantage plan. You can have end-stage renal disease and still get approved or still get accepted into enrolled into a Medicare Advantage plan. At one point in time, um, individuals with ESRD were not allowed to enroll into a Medicare Advantage plan, but now they are. So that is an option if you have end-stage renal disease. Denials are no longer apply for those with ESRD. There's also special needs plan, which is a type of Medicare Advantage plan. If there's a special needs plan that is available for your area and you qualify, that is another option. It's another type of Medicare Advantage plan that you can enroll into. Plans and premiums may change on an annual basis. Your Medicare Part B premium must continue to be paid. Okay. So joining Medicare Part C or Medicare Advantage does not eliminate the premium for Medicare Part B. Actually, Medicare Advantage or Medicare Part C, it combines Medicare Parts A and Part B. So you are still a part of Medicare. You are still on Medicare when you enroll into a Medicare Advantage plan. Many Medicare Advantage plans include prescription drug coverage, Medicare Part D. So it's Medicare Part A, Medicare Part B, Medicare Part D, kind of all wrapped into one plan. These plans are offered by private health care companies. They have commercials on television. Many of the companies that provide group health plans for under 65 individuals also offer Medicare Advantage plans or Medicare Part C plans for those that are 65 and older. So you can choose between healthcare companies, company A versus company B, and you can compare plans, which plan offers more benefits, which plan has greater savings, and decide which plan has my doctor, which plan has my hospital, which plan covers my prescriptions at a lower cost. These are things that you can compare, but they are all offered by different healthcare companies, private companies, but they're all administered by the Centers for Medicare and Medicaid. Many of the Medicare Advantage plans also cover and offer additional benefits, vision, hearing, um, wellness services, gym memberships are offered by are often included into Medicare Advantage plans. And they have networks, okay, HMOs, PPOs, special needs plans, and we can discuss that in detail in a few moments. So here we are. um, the two most common types of Medicare Advantage plans in terms of network is going to be your Health Maintenance Organization or HMO, or your Preferred Provider Organization PPO. Um, Most beneficiaries look into a Medicare Advantage plan that includes prescription drug coverage. So you get all of your benefits all wrapped up into one plan, your hospital coverage, your doctor coverage, and your prescription drug coverage, all a part of the same plan. An HMO basically is more restrictive. It has a set network. And if you are a part of that plan that is an HMO, then your choices in terms of providers, in terms of doctors, in terms of specialists, basically have to be a part of that network. And if they are not a part of that network, then you can face higher costs, or in some cases, no coverage at all, because you chose to go outside of the network to receive care. All right. So that is an HMO. It's pretty restrictive. This is our network. These are our doctors. These are our hospitals. These are our providers. You have to choose out of the doctors and the providers that are in a part of our network. By contrast, a PPO, Preferred Provider Organization, is another type of Medicare Advantage plan. It also has a network of doctors and providers. However, the PPO does allow its members to get care from doctors and hospitals and providers that are also outside of that network, um, typically at a higher co-payment. However, you do have the option to receive care and visit providers outside of the network of that Medicare Advantage plan with a PPO. So it offers more flexibility than an HMO does. And a lot of members do like that option because it gives them more flexibility, a little bit more control over their healthcare and who they see. Maybe they have a doctor that they have a really close relationship with, and they don't want to change doctors, but they really like this particular Medicare Advantage plan for its benefits. Um, and that particular plan will allow them to continue to see their doctor, even if there's a little bit of a higher copayment for that option. Okay. Um, the other very common Medicare Advantage plan is a special needs plan. Special needs plan, they're not available in every area, but for those that do have a special needs plan available for their area, and if they qualify, they can enroll in a special needs plan. There are special needs plans for individuals that have certain health conditions like diabetes. There are special needs plans for individuals that may have a certain financial status, like they're on Medicaid in addition to being on Medicare. Um, if you qualify for a special needs plan, it can be a really great option because they are typically the richest plans when it comes to benefits that are offered under the Medicare Part C, under Medicare Advantage plans in general. The catch, though, is that you have to qualify to be eligible to enroll into that special needs plan, and by design, it's restrictive. So if you don't have Medicaid and Medicare, then you cannot enroll into that special needs plan that may be available for your area because that plan is only for individuals that have Medicaid and Medicare, and maybe even a certain level of Medicaid is required to be eligible to enroll into that plan. So that's as an example. But HMO, PPO, very common, two most common, and then also special needs plan, also a very common type of Medicare Advantage plan or Medicare Part C plan, still a part of Medicare, still administered by Medicare, still got Medicare Part A, Part B, Part D if your plan includes prescription drug coverage, which is very, very common, MAPD. Okay, so that's Medicare Part C. That's one option as to how you can cover the holes or the gaps that exist in original Medicare. Because with Medicare Advantage, your payment structure basically is, besides your Medicare Part B premium, your payment structure is basically to make co-payments when you go for service. So you will know ahead of time to go to the doctor, the co-payment is X. To go to the specialist, the co-payment is X. To go to the hospital, the co-payment is X for a certain amount of days. To ride in the ambulance, the co-payment is X. So there are co-payments pretty much set for each type of service or coverage um, set by that Medicare Advantage plan. So you don't have the 20% coinsurance that you would have under just Medicare Part B when you are a part of a Medicare Advantage plan. So it is an option as to how to cover the gaps that are existing in original Medicare Part A and Part B. Okay, so we covered Part A, covered Part B, covered Part C. This is Medicare Part D. Medicare Part D is prescription drug coverage. Enrollment must be either during the initial enrollment period, or you may have a special election period, or you have to wait for an annual enrollment period to enroll. Um, must enroll. Coverage is not automatic. Penalties will apply if you miss your initial enrollment period. Prescription drug coverage costs vary from plan to plan. They are offered by private healthcare companies. Okay, the benefits can change from year to year. They always try to compete for members, and they try to compete for membership each year. So they're always trying to improve coverage and lower costs as best way as they can from year to year. So you can change prescription drug plans from year to year as as you see fit. Cost of prescription drugs, including many recommended shots or vaccines, are included. Catastrophic coverage offers protection from high drug costs. Each plan has a formulary, which is basically a list of drugs that it covers, and you want to look at that formulary before you decide which plan you want to enroll in, because you want to make sure that the prescriptions that you are taking are covered on the formulary for that plan. Okay, and the formulary can change from year to year. Be sure to verify your prescriptions before you are enrolling into a Medicare prescription drug plan or Part D plan. Okay, most drug plans do have the drugs that they cover organized into tiers, which are basically groups of drugs, and they're divided by cost. The higher the tier, the higher the cost. The lower the tier, the lower the cost. Some prescription drug plans have some prescriptions that you can get at no cost, because they're tier one. Um, and so you can basically see what your prescription costs will be based on the tiers of the prescriptions. Okay, but this is Medicare Part D. If you have, or if you choose to stay in original Medicare Part A and Part B, then it is highly recommended that you also enroll into Medicare Part D so that you have your drug coverage. Even if you do not currently have any prescriptions or taking any prescriptions, you still want to have be a part of a Medicare Part D plan, because you want to avoid the late enrollment penalty, and things may change down the line and where you actually going to need some drug coverage. Okay. Um, so that is Medicare Part D. You must continue to pay your Medicare Part B premium, and there's always, in most cases, and also a premium for your Medicare Part D plan also. So you will have a Medicare Part B premium, and you will also have a Medicare Part D premium as well. All right. All right. So if you are someone that is choosing to take original Medicare, you've got Medicare Part A, Part B, you've enrolled in your Medicare Part D plan for your prescriptions. As I mentioned, Medicare Part D is just for prescriptions, but it doesn't fill in the holes that are left by original Medicare. So the other option to do that is to enroll into a Medicare supplement plan or a Medigap plan. Medigap plans are all standardized. All right. Must be enrolled into Medicare Parts A and Part B. Must be a resident of the state where you are applying for coverage. So if you live in the state of North Carolina, you cannot apply for a Medicare supplement plan that is for the state of South Carolina. Okay. Must be age 65 or greater, unless you have certain disabilities that you qualify for earlier coverage in your state. In many cases, if you have a disability and you are under the age of 65, the cost for Medicare supplement plans in those cases is typically higher. You pay the private insurance company a monthly premium for your Medigap policy, in addition to your Medicare Part B premium, and also in addition to your Medicare Part D premium as well. All right. Um, Medicare supplement plan insurance companies, they compete, but they compete by premium. All of the plans are standardized. So one plan, um, and they're standardized, and they go by letters. And letter A, plan A, is the same at this company as it is at another company. There is no difference in the benefits of the plan. The only difference is what the insurance company will charge you for the plan. So you and your neighbor could have the exact same plan, and you and your neighbor could be paying two totally different premiums because you chose two totally different private insurance companies for your Medicare supplement plan. So it's always important to shop for the plan that you want, to find the lowest premium possible for that particular plan. Okay. You can also apply for Medicare supplement plan if you have end-stage renal disease. You can apply. It's not a guarantee that you will get approved, but you can apply. Guaranteed issue during open enrollment. So during that first 6-month period, that the month that you turn 65, and the next 5 months after that month, that 6-month period is guaranteed issue, open enrollment for you if you want to choose a Medicare supplement plan. You cannot be denied a Medicare supplement plan during that initial 6-month period. irregardless of your health conditions. You could have cancer. You could have, um, HIV, AIDS. It doesn't matter. If you apply for a Medicare supplement plan during your initial enrollment period, you will be accepted into that plan for coverage. And as long as you maintain your premiums, you cannot be denied or canceled coverage beyond that point. Okay, coverage expands um, across the country. Okay, and again, guaranteed to continue as long as your premiums are current and you have not made any misrepresentations on your application. Okay, cannot be denied coverage. You can be denied coverage if you enroll late after that 6-month initial period and it goes by your health. All right. Um, Medicare supplement plans are designed to fill in the gaps that exist by original Medicare. Those deductibles, those coinsurances, those co-payments can all be paid by your Medicare supplement plan. And all you would be responsible for is just paying that monthly premium to your Medicare supplement company, in addition to your Medicare Part B premium and your Medicare Part D premium. It's another way to fill in the gap, but a way to basically have a fixed cost on a monthly basis for your healthcare. All right. When you go into the doctor's office or to the hospital, based on your plan that you choose, you may have nothing to pay at all. Okay. Whenever you go to the doctor or hospital or ambulance, whatever, based on your plan, you may not have nothing to pay because your Medicare supplement plan will fill in the gaps that are left by original Medicare. Okay, it basically will cover, the holes that Medicare doesn't pay. Your Medicare supplement plan will pay those costs for you. Okay. Um, okay. So again, Medicare supplement open enrollment period, the 6-month period that begins the month you turn 65 and are enrolled into Medicare Part B. All right. So if you defer Medicare Part B because you are working, and then once you retire and you end your group insurance, at that point you enroll into Part B, you've got a 6-month period from that point to enroll into a Medicare supplement plan. All right. You cannot be denied coverage by a Medicare supplement plan during this open enrollment period into a Medicare supplement plan. Okay. So again, Medicare supplement plans by letter. They're lettered policies: A, B, D, G, K, L, M, and N. Plan C and Plan F are no longer available to those that are new to Medicare. Okay, so as of 2020, um, no longer Plan C and Plan F are available for those that are new to Medicare. But if you had Medicare prior to 2020, you can still choose a Plan F or a Plan C. The most popular Medicare supplement plan at this point is Medicare Plan G. It covers everything at 100% other than foreign travel. I mean, none of the plans cover foreign travel at 100%. Plan G doesn't cover the Part B deductible, but as you can see, none of the plans do. So again, these are your Medicare supplement plans, and you can choose which one that you would like to enroll in based on your needs and your financial wherewithal. Okay. So if you choose a Medicare supplement plan, again, here is what your coverage options would be: your Medigap plan plus your prescription drug plan, your Part D plan. This would be on top of your original Medicare. So you would have Medicare Part A, Part B, a Medicare supplement plan, and Medicare Part D. Okay. So these are your choices. Step number 1, enroll into original Medicare when you are eligible. Step number 2, decide how you want to cover the gaps that exist in original Medicare. You have two options when it comes to that. You can do option number one, which is a Medicare supplement plan with or without a Medicare Part D plan. We typically recommend to do it with a Medicare Part D plan. Option number two is to enroll into a Medicare Advantage plan or Medicare Part C, which combines Medicare Part A, Part B, and also, and many times, look for a plan that also includes drug coverage, which is Medicare Part D. Those are your options, option one or option two, and it's not, one size fits all. It's whatever works best for you, but it's important that you know what your options are. So how can I save money? That's an important question that many people have. And so use your benefits. Make wellness appointment as soon as possible when you get onto Medicare. Participate in your preventative services. That's important. Stay in network. If you are a part of a Medicare Advantage plan, stay in network. Know your extra benefits. Also, if you are part of a Medicare Advantage plan, know your extra benefits. There are extra benefits that you can use that can also save you some money. Review your coverage every single year. Have my finances changed? Has my health changed? Have I moved? Will I be out of my hometown for a long period of time within the next year, doing a little bit of traveling? How often or how far do I typically travel in a year? Do I need coverage that follows me all over the country? Or, am I typically in one spot for the majority of the year? Are my doctors and my hospitals of choice in network? Are my prescriptions covered? Okay. Does my coverage offer additional benefits like dental or hearing or gym membership? Okay. Um, do I have control over my health care? Can I go to any doctor that I'd like to? Can I go to any hospital? Can I travel across the country and still be covered? These are all things that can help you save money as you understand what is best for you and what is the most comfortable for you in terms of how you want to cover your Medicare benefits. So that's important. So where can you get more information? If you'd like to continue this conversation, if you'd like to get more in detail to figure out specifically what might be the best options for you, you can always contact me. A couple of ways. You can go to medicarevalues.com and you can contact me there. You can also give us a call directly at area code 800-619-4450. I'm here to provide any type of assistance that I can to help you with your Medicare choices and options. You can always call 1-800-Medicare. That number is always available for every beneficiary to get information as well. You can visit them online at medicare.gov. There's also a state health insurance assistance program for every state. They can help kind of figure out if you are eligible for any financial assistance that can help you with your Medicare journey as well. Okay. So what are my next steps? Review the enrollment periods. Make sure that you understand when your initial enrollment period is and get enrolled. Okay. Review your options. Ask questions, get answers. You can speak to a professional like myself, or you can reach out to Medicare directly. Um, Research financial assistance options if you qualify, and get enrolled. Get enrolled into Medicare, preferably during your initial enrollment period. That way you avoid any late enrollment penalties. And participate in yearly review. Do not be afraid to modify your coverage every single year to keep your costs down and to make sure that you are always in the best plan that fits your needs the best as far as your coverage and your health care, but also in terms of your cost as well. So I appreciate the time. If you've made it thus far, hopefully we've answered some of your questions in regards to just Medicare 101 and how it works. And as I said again, if you need further assistance and want to continue the conversation, don't be afraid to reach out to us. We are here to help 7 days a week. Take care and stay safe.